A lack of vitamin D is indicated in a lot of health dysfunction. And a vitamin D deficiency is anything that is below the lab normal. So in the United States, that's anything below 33. Apparently in Australia, it's below 50, which should tell you as Americans that we're not that healthy, because Australia believes that you need at least 50. But your doctor here in the States will tell you you're okay at 33. It's not okay. So let's talk about some of the most common symptoms of vitamin D deficiency are. We already talked about food allergies and aversions, and that drew quite a stir because some people realized that they have low vitamin D and they are having an aversion to poultry. But some other things came up in the comments that are also absolutely true. So one is it causes mood disorders, depression, anxiety, and sleep disorders. Low vitamin D can cause an insufficient immune system because vitamin D is used in every immune response that happens throughout the body. So if you get a cold, you need extra vitamin D. If you get the flu, you need extra vitamin D. If you have an autoimmune disease, your vitamin D should be being monitored. If you have a thyroid disorder, whether it's autoimmune and that's the problem that you have, or whether you have low thyroid, and that includes if the only thing they've tested is your TSH, they should also check your vitamin D. Joint pain. It'll cause particularly low back pain and hip pain. When your vitamin D is low, the muscles around your hips actually become weak, and there are other vitamins and minerals that start leaching out of the bones that make the bones weaker, and this leads to increased low back and hip pain, and also osteopenia that could lead to osteoporosis. So if you've noticed that you started waddling when you walk because your hips hurt or they just feel weak, it could be a vitamin D deficiency. I guess since I told you what deficiency is, I should also tell you that an insufficiency is pretty much anything under the level of 70. But if you want to be getting an A on your blood work exam, I suggest you get to 85. Number 4, hormone imbalance, particularly in males, low testosterone, and the inability to build muscle. Both cholesterol and vitamin D are needed to produce testosterone, so it makes sense that if you've been on a statin drug for a while, you might see low testosterone, and it also makes sense that if you have a vitamin D deficiency or insufficiency, you would have low testosterone. So we should be checking our males who are complaining of weight gain around the middle. We should be checking our males who are complaining of fatigue, mood disorders, anxiety, and we should be checking our males who are having trouble with erectile dysfunction and low libido. Another one that a lot of people don't think about would be your eyesight. Your vitamin D is needed for every single one of your tissues, and it is important to get your eyes exposed to sunlight before 10 a.m. every day without sunglasses on. This is because the eyes also need vitamin D, but they need to perceive sunlight because it will help your melatonin cortisol cycle, which also helps your body produce more appropriate hormone balance in your body. Number 6 is insulin resistance. If you've developed insulin resistance, or you have more episodes where you feel hangry and eating relieves that, or drinking coffee relieves that, it's maybe a symptom. I mean, it's for sure a symptom that your blood sugar is out of balance, but it's also maybe a symptom that you have low vitamin D, because there's actually clinical research that shows that people who are diabetic have a higher incidence of low vitamin D than people who are non-diabetic. And it starts showing up as early as the diagnosis of prediabetes. So what would happen if we checked it before they even got to the diagnosis of prediabetes? Because vitamin D improves, meaning decreases, insulin resistance, which could decrease your risk of becoming diabetic. Now, one of the That's because those brightly colored vegetables, including tomatoes, which are actually a fruit, contain vitamin A or beta carotene. Now, some people say take cod liver oil, but according to recent research that was published a year ago, most of the oils found, omegas, cod liver oil, etc., are either tainted with something that shouldn't be in there, or they've gone rancid. So I'm going to take something that I know works and has worked for me for over a decade, as opposed to all of a sudden switching to something that might be rancid and create more inflammation in my body. If you're looking to connect with me to figure out how you can improve your health, or you're interested in the annual membership where you get your blood work done twice a year and have a plan set in place for you every 6 months where we meet one-on-one for 90 minutes, click the Learn More button. If you just want to follow me on other accounts, including my YouTube, all of that can be found in the profile.